Hello. Thank you for choosing Orthopedic Center of Illinois for your surgical needs. Please watch this informational video regarding your upcoming surgery. We will discuss preoperative education, what to expect the day of surgery, and postoperative education. Preparing for surgery. 3 to 4 weeks prior to surgery, schedule your prehab visit that is with a physical therapist to perform home exercises and get instruction on how to move around your home after surgery. Schedule an appointment with your primary care physician for a history and physical and lab work. Schedule an appointment with your dentist to verify you don't have any active infection or cavity. Schedule an appointment with your cardiologist if applicable and discuss the need for holding blood thinners if you use them. Quit using nicotine products such as cigarettes, vapes, nicotine gum, and patches. Obtain a two-wheeled walker, which can be done during your prehab session. And improve your diet. Eat as healthy as possible, build your iron levels, and drink plenty of fluids. Prehab must be done prior to surgery unless you've had a joint replacement in the last 12 months. Bring any unanswered questions. Bring your walker if you have one. If not, we'll provide you one during prehab. The objective of prehab is walker training, stair navigation, getting in and out of bed or a chair, tub and shower transfers, and a car transfer. 1 to 2 weeks prior to surgery, complete your nasal swab for MRSA. This lab is valid 4 to 14 days prior to surgery only. You may receive a call from pre-admissions to review your information. Stop taking certain medications, and this is to be discussed with your primary care physician, such as Ozempic, Wegovy, Trulicity, Mounjaro. You'll hold those 1 week prior to surgery. And if you take Ribelsis, Victoza, Saxenda, and Byetta, you'll hold those the day of surgery. Stop shaving your legs 3 to 7 days prior to surgery to prevent cuts. No manicures or pedicures to prevent infection. Prepare your home for your return. Continue your exercises learned at your prehab appointment. And verify therapy is scheduled to start 2 days after surgery. Arrange transportation for your therapy visits. Injury and complication prior to surgery is very important. Keeping your body free of cuts or scrapes to prevent infection. Stop shaving your legs 3 to 7 days prior to surgery. Again, no manicures or pedicures. Be sure to keep your pets from scratching your leg. Avoid injury to your leg when working outside. And if you have any cuts or open sores, contact our office immediately. Preparing your home, removing obstacles like small rugs, furniture, making sure your walker fits through doorways and around your home. Freeze ice packs so you have them to use upon your return home. Have medications ready for your return home. And gather pillows to use for elevation and sleeping. If needed, install handrails or grab bars in your shower or by your toilet. Packing for surgery. Bring your photo ID and insurance card, a current medication list and the last time you took that medication. Living will and power of attorney paperwork is optional. Bring comfortable clothes, walking shoes, your walker, please bring that into the facility, and your CPAP or BiPAP if you use one. The night before surgery, you'll drink 20 ounces of Gatorade, clear or yellow, Gatorade Zero if you're diabetic. You'll be provided 2 packets of antimicrobial soap. The night before surgery, you'll wash head to toe with your normal soap and shampoo. On a fresh washcloth, you'll put 1 packet of your antimicrobial soap, washing chest, arms, back, and legs. Let the soap absorb into your skin a couple minutes prior to rinsing. Do not eat or drink anything after midnight except Gatorade. Get some rest and pack your items. The morning of surgery, you'll drink an additional 12 ounces of Gatorade and complete that 2 hours prior to your provided arrival time. You'll shower with your 2nd packet of antimicrobial soap, again, chest, arms, back, and legs, Let it absorb into your skin prior to rinsing. Take medications as directed with a sip of water. Your arrival time is at least 2 hours prior to your surgical time. Check in at the designated area. The Orthopedic Surgery Center of Illinois, you'll check in at the west door on the 2nd floor. At HSHS St. John's Hospital, you'll check in at the Pavilion 2nd floor. At Springfield Memorial Hospital, you'll check in at the main door to the left, surgery check-in services. And at Jacksonville Memorial Hospital, you'll check in at the main door. Upon arrival to the facility, the anesthesia team will see you. They will discuss the risk and benefits regarding anesthesia. If you've had issues with anesthesia in the past, please let them know. Typically, with a total knee replacement, a spinal anesthetic is used. The benefits of spinal anesthetic are less nausea, faster wake-up time, less grogginess, reduced postoperative pain due to numbing effect, reduced risk of blood clots, and less blood loss during surgery. The risks are a drop in blood pressure and headaches and tenderness at the site. With spinal anesthetic, you will also receive a nerve block that involves numbing the specific area of the body, like your surgical leg. This helps reduce postoperative pain for several hours after surgery. If spinal anesthetic cannot be completed, there is an option for general anesthesia. General anesthesia is a combination of medications that put you in a sleep-like state before surgery, and it can cause grogginess, nausea, and slower wake-up. You would still receive a nerve block in addition to general anesthetic. Plan to have assistance 48 hours following surgery. Arrange for help with your household chores, grocery shopping, and meals. Make arrangements for your pets, and arrange transportation to and from therapy. Complete your postoperative exercises provided 2 times a day. These are provided by therapy during prehab. Sit up in a chair the evening of surgery. Do not sleep in a chair. Move around your home every hour unless you're sleeping, as rest is important. Rest. Pain, swelling, and too much activity are all related. Apply ice or other cold therapy to reduce swelling and pain, 20-minute intervals. Using compression is not necessary unless you have significant swelling. At that time, you could use an ACE wrap to help with that swelling. Elevate your knee on pillows above your heart to help reduce swelling and pain. Do not elevate in a recliner or an ottoman. Use the couch or bed. Use pillows to elevate your lower extremity above your heart as seen in the picture. Keep your knees straight and hang your heel off the edge of the pillow. Pump your ankles during elevation to help prevent blood clots and improve blood flow. Eat as healthy as possible after surgery and drink plenty of fluids. Use pain medications as directed. Do not use additional Tylenol while taking pain medications. Use a stool softener like Colace while taking pain medication to avoid any constipation. If constipation becomes an issue, you may use a laxative. Common laxatives are milk of magnesia, Miralax, or a Fleet's enema. Take aspirin as directed. Do not set alarms for pain medication while resting. Take medication once you awaken, and rest is important. Injury and complication prevention after surgery. A risk of surgery is developing a blood clot. Signs of a blood clot are increased swelling in your thigh, calf, or foot, pain and/or excessive tenderness in your leg or calf that is not reduced with exercise or medication. If you experience any of the above, please contact your surgeon's office. Preventing blood clots are being active and using blood thinners as directed. Reposition often and make sure you're pumping your ankles when seated. Pulmonary embolism is a blood clot in your lung. The signs of a pulmonary embolism are new, sudden onset of chest pain and/or shortness of breath, unexplained anxiety. If you experience any of the above, please go to the emergency department. Preventing pulmonary embolism, again, is being active, using blood thinners as directed, and repositioning often. Signs of infection are increased redness, heat, or swelling around the incision, persistent fever greater than 101 degrees Fahrenheit, chills, foul drainage from the incision, and increasing incisional pain. Use proper hand hygiene at all times and ask others touching around your surgical site to do the same. Do not soak your incision and prevent injury to the extremity like cuts and scrapes. Be cautious. Your surgical leg may be weak, so ask for help to prevent falls. Pain medication can cause dizziness, so sit on the edge of your seat prior to standing and walking. Use your walker to move around your home for safety, and remove obstacles from your home. You will be provided follow-up appointments with your surgeon, their nurse practitioner, or physician assistant. X-rays will be taken at your follow-up visit. Showering and incision care. Dr. Allen, Dr. Church, and Dr. Mulshine allow you to shower on post-op day 1. Dr. Heron and Dr. Sharma allow patients to shower on post-op day 2. After showering, dry your incision really well before covering or getting dressed. If drainage occurs, cover the gauze and reinforce as needed. We are here for questions. Please call with any questions to our main line, 217-547-9100. Before you decide to go to urgent care or the emergency department, please contact our office, as we always have a physician on call to assist you with your needs. Again, thank you for choosing the Orthopedic Center of Illinois for your surgical needs. We look forward to helping you.